Good evening. My name is Peter Copp, for those of you who do not know me. I am the lead GP and the medical director of GP Plus Limited. I set this practice up back in 1999 and it's been some journey, and there have been a few events which have taken place which have stuck in my mind. 2 years after opening, I remember feeling the same kind of way when the Twin Towers event took place, and all of the fear and panic and understandable outrage that took place after that. And the world has never been the same. I think with some recent events that have taken place, we may be also crossing another paradigm when things will not quite be the same. But I do think there's some cautious tone that can be optimistic. I think some things might change for the better, and even here we can sense that. So I was actually approached the other week by one of our corporate customers to produce a video that they could distribute amongst their staff. Now, they are a very forward-thinking organisation, and thankfully, due to the nature of the work that they can do and very successfully do, a lot of that can be done from home. Now, depending upon the type of job people do, that may or may not lend itself to good business, but in this particular case, it does. And the idea was to try and provide some guidance about the situation that's unfolding in front of us, as well as some extra information about self-care management with regard to COVID-19 infection. So here we are. It's been a very, very busy week or so. I have been involved in all sorts of activities, ranging from supporting the NHS, supporting individual NHS colleagues, making laboratory orders for testing equipment, dealing with various companies on either side of the Atlantic and even in the Far East. And so it's been a huge journey for me, a huge learning curve, but nevertheless I've had to try and stay grounded and also focus on delivering the care that we do here at Dundas Street. So I've opted, well, now that I found the time, to make a more generic video. Maybe it could be useful for individuals, their families, and perhaps even for businesses like this particular one. And some of it you'll have heard before. I've sent out a number of email bulletins to my own regular patients, and they'll be fairly well acquainted with most of the issues, but maybe there'll be some new things that may be of some benefit. There's lots of information out there, and I personally will still look at the UK government coronavirus website, certainly once or twice a day, not just at the numbers, but just looking again at the latest guidance. Things have shifted fairly quickly. All sorts of changes have taken place, and some of them have fairly far-reaching consequences. And I'm no economic expert, but goodness knows what lies ahead. But I'm sure somehow or other we'll all get through it. I think we know, obviously, where this virus has come from. In my personal experience here, I've seen coronavirus every winter and spring for many years. The fact is that it's often just put down to one of the many winter colds, and generally speaking, they are not tested for, despite the fact that PCR type DNA testing has been available for some time. But I do have a number of, let's say, international clients who are more used to dynamic confirmatory testing for most illnesses, even if they're self-limiting. So I've tested and had positive coronavirus isolates going back, and it's quite clear that it is part and parcel of the fabric of our society, and probably has been for a long, long time. This new mutation obviously has been attributed to the practicing in the wet markets in Wuhan in China, The DNA bit that's different in this COVID-19 strain is allegedly originally from the bat population, but somehow or other, via snakes or maybe even pangolins, they've ended up crossing from the animal kingdom into the human host, and that small but critical mutation has made itself known quite spectacularly in China, and now the situation in Italy is equally dramatic and catastrophic. The good news from Italy is that the death rate is now beginning to slow down, and the data is there for everyone to see. I've already told my own patients about the MedCram website, www.medcram.com. Absolutely fascinating. And for any budding scientists out there, or people that are just curious, the explanation and teaching by the doctor is just outstanding, and it really helps people understand what's going on, both at the level of a tiny little RNA virus, right down to the kind of population management, and how logistics are challenged and maneuvered. Anyway, the virus is now certainly with us in the United Kingdom, and we have a problem. Behind me there's a picture of a chap called Nye Bevan, who is largely credited with the setting up of the National Health Service, and it's a great British institution. And I have served in it for many, many years before becoming a private doctor. I am eternally grateful for all of the experience and training that I had, and I still liaise with it in a whole number of different ways. The NHS is in crisis. It's been in crisis for a long time. It's been a political football. It can't be sorted by any incumbent government. My own belief, not that you want to necessarily know that, is that it would need to be a cross-party project over many, many years to try and reform this enormous and very convoluted organisation. And we have some fantastic people working in it, but the organisation itself is not what it should or could be. Now, one of the particular problems in the NHS is that we have one of the lowest numbers of intensive care unit beds per head of population in the entire European region. Germany, I think, has maybe 4 times as many intensive care beds than we do. Now, you may be wondering what this is all about. Well, this is about the whole problem. We are currently in lockdown, and what we have is an attempt to suppress or flatten the curve of infection here in the United Kingdom. Italy had a peak like this, and it looks like they're maybe going down the other side. And the system was absolutely flooded. The NHS cannot sustain an event of this magnitude. It's just totally impossible. So the idea behind the current restrictions on movement are that we flatten the infection curve down like a pancake, and the idea being that the very small numbers, and we'll come back to that, of people that get acute respiratory distress syndrome, ARDS, the numbers of people who do get that are coming through on a manageable, intermittent level over a number of months, maybe many months, so that the NHS critical care facilities can cope with the numbers without being put in the awful situation of maybe not being able to help. Now, we'll come back to that now, in fact. Coronavirus is a common cause of winter cold. COVID-19, for the vast majority of people, is a benign, self-limiting illness. It's not a nice one, and I've spoken to many people on video link this past week or two. many who are going through this. Not pleasant at all, but it comes to an end and people recover. And most younger, fitter people without any underlying medical conditions, by the time day 8 comes, they're kind of wondering what all the fuss was about. There are a small number of people that don't seem to get many symptoms at all, but the very classical presentation is abrupt onset of a dry, hacking cough, a quite characteristically unpleasant cough, nothing coming up, quite sore, associated with a pretty brisk fever in most people, but not everyone, and also accompanied by some muscle pains, a bit like flu, but not, I would say, as bad as influenza, but certainly noticeable, and some other non-specific symptoms. But interestingly enough, although many patients, and this was reported in a number of countries, lose the sense of smell and or taste, the actual cold type symptoms, the nasal congestion is not a major feature. So that seems a little bit peculiar about COVID-19, is that you can get this abrupt loss of the sense of smell without there being a bunged up nose. And often the loss of smell is a forerunner to the onset of the infection. And in some younger, fitter people, I'll come back to that too, that's all, it seems to be the only symptom that they've had. So pragmatically speaking, we've suggested that those individuals self-isolate for 7 days and undertake the other recommendations, i.e. the other members of their household would also self-isolate, but for 14 days. There's been some confusion about that, and I think most people understand it now, but the incubation phase of COVID-19 is on average between 5 and 6 days. So the 14-day period allows, if you like, the incubation phase for those immediate contacts, plus another week for the illness, and there we are, that's 2 weeks. So loss of sense of smell, please note that, and certainly the very astute clinician on MedCram has actually dealt with this in his latest update. I felt quite good that I might have beaten him to something because he's really clever compared to me. Anyway, that's the thing of it. Now, we're getting newspaper stories of pretty sensational and alarming stories. Jim Bunny ends up in ICU, super fit athlete fighting for his or her life. And yeah, these are terrible stories, but we don't get the truth. The truth is that nearly all of these people who have this overwhelming ARDS, acute respiratory distress syndrome, are people who we can already identify as being at risk. Now, this NHS, which has been around for a long time and does some things badly, but does many other things very, very well. And over the last 10 years or more, it's adopted a lot of biological therapies, which have transformed many chronic inflammatory illnesses. There are lots of young, healthy adults leading full lives and going off to the gym, but they may be on a special pill once a week, once a day, an injection once a week, once a day. And these drugs, these really important drugs which modulate the immune system, allow these other conditions to be in remission. However, some, and in fact many of these drugs, make those individuals much more vulnerable to overwhelming viral interference. And I think that is what we're seeing here. And these stories do not convey the true picture. So the younger people who are developing ARDS are people essentially who are at risk of it. And it's not just the very frail elderly who have underlying cardiorespiratory disease. And we're not talking about people who've got mild blood pressure here or slightly high cholesterol. These are patients who are often breathless on a good day. And I'm afraid that these individuals are at much higher risk. There's no question about that. And some of the more draconian self-isolation measures for 12 weeks, let's say, are essentially aimed at those people who have serious enough underlying diseases and established problems that they are simply better off having minimal, if any, contact with the outside world. And some of those individuals have fought very hard to get their health back. Some of those individuals are on powerful immunosuppressants and enjoying the well-being that comes with that. And to have that completely shattered by what seems to be a fairly otherwise innocent virus is not a price worth paying. But you can understand the attitude of others who, if they're young, fit, healthy, under the age of 30, non-smoker, and they might easily think, well, if it's a heavy chest cold for a week and I'm fitting well, why don't I just get on and have it? And I'm sorry, I accept that, but that's not what this is all about. We are flattening the pancake of infection so that the numbers of people who do need intensive ventilatory support can be accommodated by an NHS that's already struggling to meet demand. And that's where we're at. So I think it's very important for most people not to be worrying about acute respiratory distress syndrome. It's been interesting, I've seen a number of individuals who've definitely had COVID and doing video consultations, and it's quite clear that some of them are having panic attacks, hyperventilating, and that in itself very distressing for the individual. And of course they believe that they're needing to be whipped off into hospital, and it's a difficult issue. And I suspect some of those individuals had rushed away from London and other parts of the UK to come up to second homes here, third homes in Scotland. It's all been a bit dramatic, and they've brought their coronavirus with them. And I do wonder whether the whole thing has just been a furore of anxiety for individuals, and when they do then become ill, they find it very difficult to cope. So, we have to try and be sensible. We have to try and be prepared. We have to try and do things according to the advice that we're given. Now, clearly, the website still focuses on the sort of fundamentals of staying indoors, except for these journeys, ideally one a day, where you will pick up food and fuel, attending health, coming to see the GP, but not with your COVID-19, thank you very much. But there are lots of reasons why people still need to see a doctor. There are lots of conditions and problems and lumps and bumps and new issues, diabetes and all the rest. Life has to go on and care is still provided. So it is recognised that people need to go out for healthcare reasons, to go and get fed, and of course to go to work. Talked a bit about that earlier. Some jobs are unfortunately about being there, and there is no way around that. I have a team here who are part of our essential service, and we do the very best we can to support them. But we do need the troops on the ground so that we can continue to provide the high levels of care that people are used to receiving. And our patients are still there, and they still need their review, their management, their treatment. But many other employers have the capability of distributing work in different ways, and I think maybe one of the good things that might come of this is that there's a more free-floating discussion about work-life balance, about how much work can be done at home and has to be done at the office, and how much travelling we really have to undertake. And there are bigger issues that go with that, such as carbon footprint, all the rest of it. We won't do the Greta thing, that's a separate matter altogether. Anyway, these are the key things. So staying in, except for these perfectly reasonable journeys. And the only people that should be staying in all the time are those people who are essentially grounded for 12 weeks with well-recognized serious medical problems and or treatment thereof. And in fact, it's often the latter. It's often their requirement for powerful immunosuppression that means that they really need to ring fence their lives. And that doesn't come without its own issues. We need to stay 2 meters apart when we're outside, avoid congregation. Clearly there are issues in London with the tube, and Boris Johnson got very upset the other weekend with all sorts of events that had, smaller events that had taken place in London. I think the message has got across. It's not that difficult to stay 2 meters apart where I live in Peebles, but it is difficult to do that on a tube in London. And we probably just need to keep ramming home that message about which journeys are essential and are there other ways of attending to these errands. It's difficult to anticipate that they can enforce that only NHS workers can use the tube. I just don't see that being feasible. So, yeah, there are challenges and there are no easy answers to everything. The next key, or the third bit of the key advice from the government, is washing hands. And yes, washing hands, very important. There's actually a video on the UK Gov website. If you look at the coronavirus section and go into the section looking at numbers, they've got a nice link to YouTube. And we say, oh, we can all wash our hands, of course. But actually, you'd be surprised. If you watch how it's done properly, I reckon most of us still could do with a bit of learning and reflecting on our technique, and particularly getting in between your fingers with soap and water. And whether you sing happy birthday several times or whatever you do, there is a good way of washing your hands. And it's not just about doing that after you've been to the loo. We're talking about washing your hands when you've picked up the post or had deliveries, or people have passed things to you that you have no option other than to take or and open or process. That's just the way of it. To be fair, a lot of the courier companies are already adopting good practice, and were adopting good practice before the government made announcements, and I take my hat off to them. And I also take my hat off to all of the other essential services. There are people still driving buses and delivering the post, and we should be grateful for that. They are all doing their very best. It's not just about the NHS. So what about the aspect of what we can do as individuals? Part of the reason that I have a visceral interest in infection is that I was born with a condition where I don't produce a thing called IgA, which is immunoglobulin A. And essentially, immunoglobulin A is part of the armory of immune defense that patrols the external surfaces of the body. Therefore, over my lifetime, I've had several pneumonias, lots and lots of sinusitis, and an abscess in my frontal sinus when I was a teenager, lots of tummy upsets, and I get cold sores and skin infections. Yuck, not very nice. They're all very manageable and not very serious. But it does mean that in a situation like this, I have to think a lot more carefully about what I could do to reduce my risk of being infected, and also on the basis that I may actually be more at risk of ARDS for a number of reasons, largely in relation to that. So it was interesting, actually. I got an email from one of my colleagues, Dr. Francis Carnegie, who has started helping me here at GP Plus. And he had noted that there had been a meeting with a local virologist, and they'd produced some clinical papers looking at, and the small numbers involved, but clinical papers looking at the virucidal effects of hypertonic saline. That's essentially salt water at the kind of seawater level of concentration. These papers are available and they are logical, they make sense. And products like Sterimar have been around a long time. I don't have any shares in Sterimar, not knowingly. I don't think I've got many shares left. There's another reason for that. Anyway, Sterimar has, I think, started in France, in Ile de Ré, a long time ago. It's been probably bought out several times. I still think there's a business opportunity for someone to make Hebridean seawater spray. So if there are any budding entrepreneurs out there, give it some thought. We've got some of the best seawater out in the northwest, so bear that in mind. But here we are. We have Sterimar on the shelves. Now, this hypertonic nasal saline, I will use certainly between each patient. I certainly have it in the morning. I use it before I go to bed. I will apply it before I go out to the shops and when I return from the shops or the fuel station. And it's quite an easy thing to do. Give it a little shake and you pump. It's a pump device, and of course it's not working now because I think, oh, there we are. And interestingly enough, because it's a bit irritant, it can make you sneeze once or twice afterwards, but that's a good sign. Now I can feel that saline running down the back of my nose and into my nasopharynx. Now, that's exactly what I want to do. And what I am doing there is creating a hostile environment for a virus or any COVID that may be there and already replicating. Now it looks like the chloride ion in sodium chloride is the thing that shatters the cell membrane of this RNA virus. So seawater spray, Sterimar, and if I become ill, on certainly the first 2 days of the infection, I will be doing that every half an hour. And the premise of that is essentially to just simply reduce the viral load. I can't stop the infection then, but I can certainly try my best in the very early 24, 48 hours of, if you like, killing as many of these as I possibly can. Now, there are other products out there. Say I'm, again, no shares, no commission. I've ordered this online. This is a French product again, but distributed by someone in Ireland, and it's called Per Essentiel Respiratory Hypertonic Spray. Now I quite like this one, and it's got some other bits and bobs in it, including some herbs and maybe some rosemary or sage. Anyway, it's quite nice. And what I do with that one, I just carry that one in my pocket. I tend to leave this one at home or in the office. And if I'm out and about, just, and same idea. Lots of saline and create an unpleasant place for COVID to be. So, 2 nasal sprays. Now, one of the other virucidal simple products that we can use ourselves happens to be one of the ingredients in a Colgate mouthwash. Now, I've never been interested in using mouthwashes, but now I am. And so this Colgate Plaque Soft or Cool Mint. It says plaque protection effectively fights bacteria. Well, it's not about bacteria. This is a thing, a chemical in it called cetyl dihydropyramide, or anyway, it's a acetyl chemical, so CETYL with a chloride ion on the end. And so what I do with that, it says 0 alcohol, by the way. I don't know if that's good or a bad thing, but all I'll do is have a little mouth rinse, maybe every couple of hours, just in case, again, there's virus that's over the back of the nasopharynx and down into my throat. So just a little gargle with this mouthwash, spit it out. I'll do it in the morning just before I leave to come to work, and I do it again if I'm going out, coming back from going out, and again before I go to bed. And the idea, again, before going to bed, is that if somehow I've acquired virus, I'm about to hopefully lie down and rest for 6, 7 or 8 hours and not do very much. So anything I can do to make my body, my system less friendly to these things, in my book, is a good thing. They're all safe, they're not expensive. That's £3. They're all under £10. So yeah, not everybody can even afford that, but if you can, then I would give it some serious thought. So there we are, a few different things that I do. I certainly use a lot of isopropyl alcohol, always have. It's always been part of what we've been ordering and using here for the last 21 years. Now, I don't want to bore you with the story, but 100% isopropyl alcohol is not as good as an antiviral, antibacterial. 70, maybe up to 80% is reckoned to be perfect, probably 70% mixed with water. And the reason is we do want it to, if you like, evaporate. If you use 100, not all evaporate, sorry. If you use 100% isopropyl alcohol, you can actually coagulate the surface virus proteins on a contaminated surface, and then the other living virus is quite happy underneath. So 70%, if you see products being sold, that's the percentage to be looking for. You can get it as liquid, we'll use it as a surface spray, and it's been difficult because there's been a lot of profiteering on the internet. But and if you try and buy a little bottle of something, you can get absolutely ripped off. But it's still possible to buy 5-litre containers of isopropyl alcohol. Excuse me, I'll be back in a second. And there are a number of companies that do that. And we just top up. This one is a hand gel sanitizer refill, and the other ones over there, 5-litre containers of the actual 70% isopropyl alcohol. And then if you have any little dispensers at home or in your car, you just refill them. I certainly wouldn't try buying small things on the internet at the moment because the prices are outrageous. Now, one of my patients popped in earlier today to say hello. I haven't had time to read about this, but I thought it was quite funny. And this product is called Lethal, so Leithal sanitizer, hand rub formulation, C19, a little bit sensational possibly, but apparently it does contain 70% isopropyl alcohol. Doesn't actually clearly say that, but I think that is the case. So if that does measure up, then I will make good use of that as well. I do leave some in the car, and I say and that's what you have to do, is think about what you do and how you do it, and make it easy for yourself to remind yourself about these sort of simple behaviors. We're not expecting you to become like Howard Hughes and to become terrified and restricted. These are just simple things, and you just need some prompts to remind yourself. Okay. What other things do I recommend? Well, certainly it looks like those who are zinc deficient are much more susceptible to aggressive viral load, and some of these excellent webcasts by medcram.com talk about this. Now, the problem is we don't know the perfect dose of zinc to take. We don't know, and there'll be no clinical trial to demonstrate this, but we certainly know that a dose of 50 milligrams of zinc is absolutely fine. And unless you're maybe eating, a 1 kilo steak every day, you're probably not going to be getting that kind of intake. So pragmatic, simple thing to do. And of course, we've known about the possible benefits of zinc with influenza for a long time, and some of the proprietary vitamin C products that are sold in in all the major pharmacies for many years have often added vitamin C and zinc together, and that wasn't just based on guesswork. There has been work about zinc going back many years, but not in relation to COVID. So I take a 50 milligram zinc every day. made that available to our staff here, and say no toxicity issues. It's water soluble. For children, I would suggest half a dose, but actually I'll stop there because children obviously are a concern for many parents. But the good news is that COVID-19 seems to spare them remarkably well, and I personally think it's because of the fact that coronavirus is already here and has been forever, and that children, especially at the primary school, nursery stage in life, are regularly encountering coronavirus. They've got a hypervigilant immune system, they're getting lots of vaccinations, there's lots of dynamism with their immune system, and they develop a good, effective, circulating, neutralizing antibody and other substances which protect them. So thankfully, our children are probably not the ones that we're concerned about at the moment. There have been some issues with very, very young children who've not got older siblings, and that might fit with that. But certainly kids are COVID resistant. I would mention one caveat, and that would be a child with asthma, and certainly although the COVID itself may not bother them, if at all noticeably, their asthma certainly may get worse if they've got pre-existing asthma. So the same advice applies to the parents helping those children. The first sign of any cold or upper respiratory event is to essentially double up on their preventative brown puffer, and to do so and remain on that dose until at least 3, 4, 5 days of consistent improvement before returning to the normal level. Of course, there are some children that only get wheezy when they have a cold and are not normally on a preventative, and of course those parents know to start the preventative off as soon as possible, and ideally using a spacer device. I think that's very important for adults with COVID, and I'll mention that later. Okay, in terms of other things, I mean, obviously there's been great discussion about masks. Masks are really important for hospital doctors and nurses and people literally in contact with massive viral load, and there's all sorts of levels of PPE, protective equipment for those individuals. There have been issues, of course, about getting PPE out to frontline NHS GP staff, and I'm embarrassed about that. And allegedly, the masks that I've seen them wearing are the ones that really wouldn't do anything useful to protect them at all. And a simple mask, it just gets wet with water vapor, and would invite other viruses to come to you. Certainly the kinds of masks that may have any value are, if you like, respirator masks. They have certain endorsements, and the idea is that they allow water vapor to leave without the actual mask getting wet, and these can be reused. In terms of seeing people out and about with masks, I think the only time for the general public that a mask may have some benefit would be if the person, him or herself, was COVID positive. Either they were symptomatic and they were coughing, they were in shutdown in a house with their contacts, and they may simply reduce the transmission rate to their family contacts, and certainly if they go out for a walk. And I think for a lot of COVID people, we want them to, if they're not very ill, we certainly want them to move out and do things. Yes, we self-isolate, but there's no reason why someone can't go out to the garden or go for a short walk, but I would probably do so with a mask on, and I think that's only fair and reasonable. But essentially speaking, other than hospitals, masks are probably best forgotten about. A number of families have asked about other bits and bobs. Certainly thermometers can be difficult to get hold of at the moment. You can understand that. I tend to use Welsh Allen or Braun Thermoscan. There are lots of cheap thermometers out there that are probably of dubious caliber, and they're all a bit overpriced or unavailable. So just be careful what you buy if you're going to buy something. And unless you're used to using a thermometer, this isn't a great time to start. And it's very important to understand that the level of fever in itself for adults is not an indication of the severity of any illness with COVID-19, and indeed with many viral illnesses. And in fact, there's been some really interesting research done that higher fevers are probably actually good for us, and that the bigger the temperature, the more mobilization of the different killer cells and the, if you like, the targeted immune cells that we create are just more, if you like, energized in a high fever situation. Nevertheless, the advice is to manage fever with paracetamol as your primary antipyretic. And for most people over the age of 12, that's a dose of 1 gram, 2 of the 500 milligram tablets 4 times a day. I think it's very important that you don't overdose with paracetamol. If you start sneaking in extra doses, it's dangerous. You don't need an awful lot of extra paracetamol to get liver toxicity. And that's one of the reasons why we only sell such small amounts over the counter at the chemist, is that unfortunately, and certainly for many, many years, it was a common cause of very severe liver injury, and maybe younger adults taking not very many paracetamol and getting themselves into serious circumstances. So one of the things I have, however, noticed in my own journey is that sometimes it's difficult at the moment getting paracetamol from the chemist, and certainly for our own patients, particularly those who are more vulnerable, so on and so forth, you may find it easier to contact us and request a prescription for paracetamol and get a box of 100, depending on how many people are in the house and so on and so forth. And sometimes at the moment, for instance in Peebles, they're only allowing one person in the chemist at any one time, and there's a queue all the way along the high street. And I'm not sure how useful that is either, but I understand their point of view, but we're just kind of kicking the can down the road sometimes. But there are ways of getting paracetamol, and as I say, for some patients that might be better done through prescription. Okay, the reports about ibuprofen were a little bit misleading. Ibuprofen is still a very useful antipyretic, but I think what we're trying to say is use paracetamol first, but if you wanted some breakthrough pain relief or temperature reducing activity, I think for those who are not aspirin allergic or don't have a stomach ulcer or aren't on certain blood pressure medications, having a 400 milligram dose of ibuprofen is absolutely fine. Maybe even a 200 milligram dose obviously for a child or someone who was over the age of 75. So as a backup, I think that is absolutely fine, other than in very particular circumstances. There were issues in China of people taking huge doses of ibuprofen in the lead up to developing ARDS. And indeed, some of those people were taking ibuprofen having never had it before. And we know that a proportion of the population develop, if you like, acute bronchospasm, like their first asthma attack, when they take ibuprofen. So there are all sorts of confounding variables. And I think, as I say, it's a shame seeing and listening to parents at pharmacy counters getting all worked up and upset about whether to use ibuprofen, whether to take it, whether not to take it, what to do for the children. And, this is all a bit sad. But anyway, Calpol first, and then Julifen if it's a child, and paracetamol first, and then ibuprofen if necessary for an adult. And also those adults who use compound preparations like cocodamol or codidromol for other reasons, remember they also contain paracetamol. So if you've had 2 cocodamol, that means you're only allowed another 6 paracetamol over the course of that day. Don't overdose yourself on paracetamol, not worth doing at all. Okay, the only other sort of tool that I've got lying on my desk at the moment and I thought I'd just mention it because some patients have been talking to me about them. And these are largely more elderly individuals with known underlying lung disease. And of course, one of the things that happens when you go to hospital, and we have a big unit here that we use for assessing people with breathlessness, is that they measure your oxygen level. And nowadays, technology's moved on leaps and bounds, and you've got these little finger clip type oximeters. They're really very inexpensive. There's a lanyard with this one. I just carry this one in my bag, and they're probably not incredibly accurate, but they're accurate enough. According to this one, at the moment I'm dead, but I think it's going to, no, I'm not dead. No, it's coming back. So it measures my pulse, and at the moment it says that my oxygen saturations are 97%, which is okay. Ideally 99, but I never seem to get up to that level. Many of my patients have better oxygen levels than I do. And my heart rate at the moment is much higher than it normally is, about 78. Normally it's under 60. I suspect it's something to do with doing this video. It's a little bit stressful, but I'm trying to keep it going. So, oximetry. Yes, that could be helpful. And certainly we like to see the numbers always above 90%. And those patients who've got oximeters at home, they do know that once the numbers get in under 90, at high 80s, they should certainly be thinking about having a chat with their GP or healthcare advisor or the nominated person. I say I wouldn't be going and rushing out and buying oximeters. They are readily available, they're not expensive. But I think for those people who've got established and previously recorded lung disease, chronic obstructive airways disease, bronchiectasis, or they've had a lung removed at some point, whatever. This just helps to demonstrate that at the peak of the first week of illness that their oxygen levels are good. And I certainly know individuals who are camped up at the moment in Perthshire and all sorts of remote parts of the Highlands who do use these. And yeah, I think they have a place, maybe not in the middle of Edinburgh. Okay, moving along. Basics on top of all of these self-care things. I think it's very important that we eat well, we drink well, we're well hydrated, that we don't go mad. These are really exceptional times, and sometimes there are jokes on the internet about meeting someone on the sofa the other night, and it turned out to be my wife, and she was rather nice. And we are possibly behaving in different ways and learning to adapt to a different type of life. Patients have told me they've taken up painting, and nowadays, of course, with the internet, there's all sorts of things you could get back in touch with. And even I've got some drawing paper at home, and I might just be tempted to do some drawing or do something that I haven't done for a long time because I have the time and opportunity to do it. And certainly just being sedentary is not good for any of us. And the idea of sitting down in front of the television and watching a whole catalogue of soprano or whatever, I mean, great for some people, but really it's not that good for your health. It's not good for your socialization. And actually we should be moving about. And we know that simple exercise, even short bursts of going up and down the stairs several times, will actually increase your immune defenses, particularly things called your NK cells, your natural killer cells. And if you like, they are your SAS stormtroopers that are patrolling your body all the time, day and night. And do things to help them. Keep moving, do stuff. Certainly look after your brain. Try and relax. Try not to be scared. Try and talk. Do some story times over Skype with your grandchildren. Pick up old hobbies. Contact friends you haven't spoken to for a long time. use your brain and don't sit there and worry about how bad this crisis might get. It is a crisis of logistics. It's not a crisis of direct threat to the health of the vast majority of people, other than for a period of, let's say, 7 days. The one aspect of the infection that is numerically important, for maybe slightly different reasons, is that there will be a significant number of people who will get bacterial infection in the second week, maybe week 3, but certainly second week of their illness. So what happens is, average person gets COVID through the nose, through the eyes, through the mouth, down into the respiratory tract. The respiratory tract, the little tubes become very inflamed, a bit like if you've ever seen an adult or child with eczema, skin gets bright red and itchy and sore, and the same kind of thing happens on the inside of your airways. Now, after, let's say, day 6, day 7, the COVID has gone. The COVID virus is dead, and largely thanks to your immune system, which I hope you've supported in all the ways that I've suggested. And then there's a bit of a gap because this tissue needs to heal. Now, a lot of perfectly healthy, normal people, we all have a small population of bacteria that also live in harmony in our chest, in our airways. One in particular called pneumococcus, and some of you know that there's a vaccination for that, and I'll mention that in a few minutes. But those bacteria are normally in small numbers, but suddenly we've got a different set of circumstances. We've got open wounds and grazes, as it were, as if it was on the skin. And surprise, surprise, sometimes these bacteria have an opportunity to party and meet their girlfriends and boyfriends, and they have babies. And the next thing we know is that a few days later, cough maybe having gone, comes back. The cough is productive. It's not a dry cough anymore. This is a wet cough. This is a cough where there's lumps of dirty green sputum coming up, and then maybe associated with a secondary fever. And some of these people will develop a pneumonia, and especially over the age of 75, especially smokers, especially diabetics, especially people with impaired immune systems, and especially people who've had lung problems before, or previous pneumonias, or people like me with IgA deficiency, people with celiac disease. All of those people are much more likely, if they're going to have a problem from COVID, it will be not the COVID itself, but will be a secondary bacterial infection in week 2 and or into week 3. So the key thing for much more of us is to see how we do post-COVID, and to be aware of that. And for some people who are maybe in remote places and so on and so forth, maybe having access to appropriate antibiotic therapy is something they should talk to their doctor about. Certainly, we know that maybe, let's say, around about a third of these secondary bacterial infections are likely to relate to the pneumococcus, and we do have a very effective vaccine. Nowadays, our children get vaccinated to pneumococcus and have been for years now. It's part of the routine program. So many of our very young adults are well protected. But certainly, as we get older, and certainly over the age of 50, we don't have good natural immunity to pneumococcus. And the NHS has done a great job over recent years in trying to add that into the flu vaccine campaign, initially over 75s, then over 65s, and trying to make best use of its limited resources. But probably pneumococcal vaccine could be used for anyone over the age of 50, and many other countries do it that way. And certainly also for those with underlying conditions, chest disease, heart disease, celiac disease, and a whole raft of other medical problems which makes them more vulnerable. So for those people who are in those risk groups, it's not in any way too late to have pneumococcal vaccination with your doctor, or at least to question whether it's been recorded in your notes. The good thing about pneumococcal vaccine is that it can last for more than 20 years. Some people need a booster every 5 years if they don't have a spleen, and maybe in certain other particular circumstances. So, check with your doctor if you're not sure, and you are shoring up your defences. Talking about vaccination, I'm getting near the end, by the way. I might get tired. There was a very interesting MedCram presentation last night talking about the immune response to COVID-19, and indeed having a vaccination of some kind around the time of an outbreak may actually be a good thing, irrespective of what that vaccine's about. The particular emphasis was on good old BCG, which I've got quite strong feelings about. I had a BCG as part of the national programme when I was young, and I was quite dismayed when they stopped the routine BCG programme here in the UK, not many years after I became a private doctor. Anyway, I suspect they'll regret that, but the idea now is that we give BCG to the higher risk individuals who may have moved over from other countries, India, Pakistan, so on and so forth, and to try and target our management of TB in that way. Anyway, there has been some interesting research done that giving a BCG vaccine, because of the way it stimulates the immune system, that it can protect people from COVID. And please do not ask your doctor for a BCG vaccine, by the way, but there are some interesting pieces of work going on about this. And I think the take-home message at this stage is to remember that the immune system is very dynamic. It does get tired as we get older, but it doesn't mean that we can't do anything about it. There are a number of things that doctors can do about it to help, but there's so much more that you can do about it. Taking good care of yourself, exercising, not drinking too much alcohol, not smoking cigarettes. In fact, I'll mention smoking. The death rate in Wuhan was dreadful, and many of those males that died were very heavy smokers in China. And there is no question that that was a significant comorbidity with those individuals who developed a fulminant acute respiratory distress syndrome. They were very, very heavy smokers with other risk factors. So I don't want to sound like the boring old doctor that says, and in fact, as you well know, with some of us who've got bad habits, I could do with losing a stone or two, and there's room for improvement in us all. But we have good reasons now to take good care of ourselves. Try and think about our immune system as being something that we can improve, something that we can help ourselves with, and not to feel helpless, and not to just sit there in the chair and think that the world is doomed and that this infection is going to rampage through your house and consume everything. It's just not true. Try and remain positive. Think about some of the things that I've said. There's plenty of information out there. Look at the government video, the government website. Try not to get too distracted by the news headlines. I know, I love the BBC. I grew up with it. I think some of the stuff that I've seen on the BBC recently, some of it's great, but some of it is frankly ridiculous and misleading, and that's sad. And I think they should know better, but sometimes I wonder if they do. So be careful about where you get your news from. Check your facts. Try and not get drawn up with sensational stories, because usually we don't have the full story. And certainly the idea of these young people suddenly being poleaxed by ARDS, I can assure you there's a lot more going on behind the scenes. Now, I think I have said enough. I did mention in an email last night to my own patients, maybe good stuff come out of all this. I mean, certainly here at GP Plus, we've had an amazing response with a number of anonymous donors, and over the course of the spring, and from then on, we're going to have a series of analyzers on site that we can do multiple testing for multiple infections, including COVID, and that simultaneously does other 9 other viruses. Later we'll have STD cassettes, UTI cassettes, all using this modern PCR technology. So in a strange way, in all of this horrible kind of stuff that's going on, something wonderful is going to happen here in terms of my ability to provide, amazing diagnostic point of care testing. That's a really positive thing. There's lots of other positive things that could come out of this. And I made reference to this idea that maybe John Major had some foresight when it kind of went pear-shaped, the back to basics. We are all getting back to basics, spending time with the ones that you love, thinking about the things that really matter, spending time at home, thinking about all the things that you haven't done at home that you could do, things for yourself, things for your wife, your husband, your partner, your children, DIY, hobbies, whatever. I think good things will come out of this. I know there are enormous challenges for the economists, for banks, for government, but I do fundamentally believe we will get through all of this. The vast majority of people will have survived. Yes, some lives will be lost, and that is always a bad thing. But if we can cooperate with the national strategy at the moment and try and flatten down that infection curve, as things are, our intensive care can meet the trickle demand, and we all have our part to play in that. Thank you very much. If any of you have listened to this point in the video, you deserve a medal, and I will maybe make a few more, but a lot shorter and probably dealing with specific topics. I'm very happy to be contacted by email if there are particular questions or clarifications of any of these points. And I bid you all good evening, stay safe, and don't panic. Thank you.